The respiratory system, also called the pulmonary system, works closely with the circulatory system, sometimes called the cardiopulmonary system. Functions of the respiratory system. Primary function equals gas exchange. Bring O2 from the environment to the bloodstream. To remove CO2 from the body/bloodstream. Body has 4 to 6 minute supply of oxygen. Respiration. The exchange of gases between the atmosphere, blood, and cells. Pulmonary ventilation. The exchange of air between the atmosphere and lungs. External respiration. Gas exchange between the lungs and bloodstream. Internal respiration. Gas exchange between the blood, cells, and tissues. Breathing is really two separate processes. Ventilation, movement of air into and out of the lungs. Inspiration and expiration, inhalation and exhalation. Pulmonary ventilation equals breathing. Respiration, the gas exchange process. Rate, 14 to 20 breaths/minute. External respiration, oxygen and carbon dioxide exchange between lungs and bloodstream. Internal respiration, carbon dioxide and oxygen exchange between the tissue cells and the bloodstream. Cellular respiration, exchange of oxygen and nutrients to produce energy, water, and carbon dioxide. Organs of the respiratory system. Nasal cavity. Pharynx. Larynx. Trachea. Bronchi. Lungs. Alveoli. Pleura. Respiratory system. Respiratory structures. Nasal cavity has openings in the nose, divided into the right and left sides by the nasal septum. Internal nose structures. Functions of the nose: warming, moisturizing and filtering incoming air. Smell, reception of olfactory stimulus. Resonating chamber for speech. Pharynx, throat. Extends from the internal nas down to the cricoid cartilage of the larynx. Divided into 3 areas. Nasopharynx, passageway for air only. Contains the pharyngeal tonsils, adenoids. Oropharynx, passageway for both air and food. Contains the palatine tonsils. Laryngopharynx, passageway for food into the esophagus. Laryngopharynx, divides the respiratory tract into the esophagus and the larynx. Esophagus, carries food to the stomach. Regions of the pharynx. Functions of the pharynx. Passageway for food and air. Resonating chamber for speech. Larynx, voice box. A short passageway connecting the pharynx with the trachea. Composed of cartilage. Epiglottic cartilage, epiglottis. Thyroid cartilage, Adam's apple. Cricoid cartilage, attaches the larynx to the trachea. Thyroid cartilage equals Adam's apple, largest of the cartilage pieces. Larynx structures. Epiglottis. Large leaf-shaped piece of cartilage lying on top of the larynx. Unattached and acts like a trapdoor covering the opening to the trachea, which is called the glottis. Epiglottis. Glottis. The opening from the pharynx to the larynx containing the vocal cords. Vocal cords, mucous membrane folds extending across the glottis in 2 layers. Upper layer or folds, false vocal folds. Lower layer or folds, true vocal folds. Sounds originate from vibration of these true vocal cords. Glottis and vocal cords. Trachea, windpipe, anterior to the esophagus. Composed of 16 to 20 C-shaped cartilage rings stacked upon one another. Hyaline cartilage rings. Divides into right and left bronchi. Carries air to and from the lungs. Tubular passageway about 12 cm long and 2.54 cm in diameter. Extends from the larynx to about the fifth thoracic vertebrae. Lined with ciliated epithelium. The point where the trachea bifurcates is called the carina. At about the fifth thoracic vertebrae. Trachea and esophagus. Bronchi. Tubes that branch off of the trachea at the carina and extend into the lungs. Serves as a passageway for air. Left primary bronchus. Right primary bronchus. Shorter and more vertical. Swallowed objects more likely to lodge in the right primary bronchus than the left. Bronchial tree. Lungs. Paired, cone-shaped organs that occupy most of the thoracic cavity. Right lung, larger, has 3 lobes. Left lung, 2 lobes. Bronchioles, passageways for air from the bronchi to the alveoli. Alveoli, air sacs where gas exchange takes place, diffusion. Surrounded by a double membrane called the pleura. Lobes of the lungs, superior lobe, inferior lobe, middle lobe, right lung only. Left lung. Pleural membrane, parietal pleura, outer layer of the pleural membrane. Lines the thoracic cavity. Visceral pleura, inner layer of the pleural membrane. Covers the outer surface of the lungs. Between the parietal pleura and the visceral pleura is a potential space called the pleural cavity. Double membrane equals pleura, one is the parietal pleura and the other is the visceral pleura. Alveoli. Air sacs, where external respiration occurs, gas exchange between the lungs and the blood. Alveoli. Physiology of ventilation. Ventilation, the process of inhaling and exhaling air in and out of the lungs. Pulmonary ventilation, the process by which air flows between the lungs and the external environment. Inspiration, inhalation. Bringing air into the lungs from the external environment. Ventilation. Muscles of ventilation. Expiration, exhalation. Movement of air from the lungs to the external environment. Normally a passive process, no energy or muscular contractions required. Respiration types. Apnea. Dyspnea. Eupnea. Hypopnea. Orthopnea. Tachypnea. Hyperventilation. Physiology of respiration. Respiratory disorders and homeostatic imbalances. Lung cancer, most fatal cancer in the US, highly metastatic. Usually linked with cigarette smoking. Common irritants include smoking, pollution, dust particles. 20 times more prevalent in smokers than non-smokers. Metastatic dash. Emphysema, blown up or full of air. A condition where the alveolar walls lose their elasticity and remain filled with air during expiration. Alveoli become damaged and eventually merge together to form large air sacs with reduced overall volume. Patients often develop a barrel chest. Generally caused by cigarettes, pollution, industrial dust particles. Coryza and influenza, common cold and flu caused by one of many viruses. Antibiotics cannot help. Medications used to treat the symptoms. Sneezing, coughing. Congestion, rhinorrhea. May result in rhinitis. Rhinitis, inflammation of the nasal mucosa. Pneumonia, acute infection or inflammation of the alveoli of the lungs. Most common infectious cause of death in the U.S. Alveolar sacs fill with fluid and dead white blood cells, reducing the amount of functional surface area of the lungs. Most commonly caused by bacterium. Streptococcus pneumoniae. Affects those in poor health or compromised immune system. Tuberculosis, TB, caused by a bacterium. Mycobacterium tuberculosis. An infectious communicable disease that destroys the lung tissue and pleura. Replaced by fibrous connective tissue called tubercles. Disease is spread by inhalation of the bacterium.